If you're a medical coder, seeing a chart that just says diabetes can be a real pain. And if you get it wrong, well, that messes with everything from data accuracy to reimbursements. So today, we are going to crack the diabetes code. We're breaking it all down so your coding can be faster, sharper, and way more accurate.
All right, let's just dive right in with a super common situation. You open a chart, you see the note, long-term insulin use. What's your first thought? Probably type 1 diabetes, right? It just makes sense. But hang on, is that really the right call? The official guidelines have a very specific answer, and that's exactly what we're going to clear up right now.
So here's our game plan for today. First, we're going to lay the foundation with the core diabetes categories. Then, we'll open up 3 different case files to see how these codes work in the real world. After that, we'll get into those all-important Z codes for medication, and we'll wrap it all up with a quick checklist to make sure it all sticks.
Okay, let's kick things off with our first section, the core categories. Before we can even think about tackling those tricky cases, we have to be absolutely solid on the fundamentals. Getting this foundation right makes everything else so much easier.
Here they are, the 5 main categories you're going to run into, E08 through E13. But before we break them down, we need to establish our golden rule. The one thing that trumps everything else is this. You code based on the documented type of diabetes, period, not the medication. Whether a patient is on insulin or not, that's a totally separate piece of the puzzle. Just keep that idea front and center as we go.
Okay, now that we have our golden rule locked in, let's put it into practice with our first case file. We're diving into type 1 diabetes, which uses the E10 code. This is what you can think of as the autoimmune story.
So, let's meet Alex. A chart comes across your desk, and the diagnosis is clearly stated, type 1 diabetes. So, what does that actually mean, both for Alex and for how we code it?
The best way to understand type 1 is to picture the pancreas as a little insulin factory. In type 1, the body's own immune system gets confused and actually attacks that factory, destroying the cells that make insulin. The factory literally shuts down for good. This means the body simply cannot produce the insulin it needs to live.
So when you're scanning the doctor's notes, these are the kinds of phrases you're looking for. You might see ketosis prone, which is a big clue. And yeah, you'll often see terms like juvenile onset, but it's so important to remember that type 1 can be diagnosed at any age. The real bottom line, the non-negotiable fact, is that these patients absolutely require insulin to sustain life.
All right, let's move on to the scenario you're going to see probably 90% of the time, type 2 diabetes. This brings us to our second case file, and honestly, the single most important coding rule you need to know, the default rule.
Now let's meet Maria. Maria's chart says she has a diagnosis of type 2 diabetes, and her story is completely different from Alex's.
See, unlike with Alex, Maria's insulin factory is still up and running. Her body is making insulin. The problem is with the delivery system. Her body's cells have become resistant to it. So you can think of the insulin as a key that's supposed to unlock the cell to let sugar in. In type 2, that key just doesn't fit the lock very well anymore.
And this is the rule of all rules. If the documentation is vague, if it just says diabetes without specifying a type, you must, by default, code it as E11. Type 2. And this is true even if the patient is on insulin. I can't stress that enough. This isn't a suggestion. It's a hard and fast rule to make sure coding is consistent everywhere.
So let's just put them side by side to really let it sink in. With type 1, the insulin factory is closed, no production. With type 2, the factory is open, but the product it's making, the insulin, is being resisted. This is why insulin use alone tells you nothing about the type. For type 1 patients, it's a necessity for survival. For type 2 patients, it's just one of many tools they might use to manage the condition.
Okay, let's move on to a category that can be a little tricky, secondary diabetes. In these situations, diabetes isn't the primary issue. Instead, it's a direct consequence of something else going on in the body.
Let's take a look at Charles. His chart clearly says that he has diabetes because of his Cushing syndrome. So, how in the world do we code that?
This sequencing here is everything. It's not a suggestion, it's the rule. You always code the underlying condition first. So for Charles, you'd assign the code for Cushing syndrome, and then you'd assign the E08 code for the diabetes that resulted from it. It's always cause first, manifestation second.
And that cause first rule applies to all kinds of secondary diabetes, whether it's caused by a drug, a procedure like having the pancreas removed, or a genetic issue.
It's also worth pointing out that something called type 1.5, or LADA, that's latent autoimmune diabetes in adults, that also falls under the other specified E13 code.
Okay, we have totally nailed down the diagnosis codes, but that's only half the story, right? To really paint the full clinical picture, you also have to document the treatment. And that's where the medication Z codes for long-term drug use come into play.
This table breaks it down perfectly. The key is just to think of each type of medication as its own separate fact that needs its own code. If a patient is on long-term insulin, you use Z79.4. If they're also taking pills, well, you add Z79.84. You have to use a separate code for every class of drug they're taking long-term.
Now here's the crucial fine print. The key phrase here is long-term use. If a patient in the hospital gets a one-time shot of insulin just to manage their blood sugar during their stay, you do not use the Z79.4 code. That code is only for patients who are on insulin as part of their regular, ongoing treatment plan at home.
Wow, we have covered a ton of ground, from the basic types all the way to complex sequencing rules. So now, let's just boil it all down into a final checklist. These are the 4 key takeaways you can start using on your very next chart.
Here they are, the 4 rules that will keep your diabetes coding on point. Number 1, if the type isn't documented, the default is always type 2, E11. Number 2, seeing insulin use does not automatically mean it's type 1. It's a treatment, not a type. 3, when you see secondary diabetes, the cause always gets coded first. And 4, use a separate Z code for every single long-term medication to tell the whole story.
So the next time one of those charts with just the word diabetes lands on your desk, you're not going to be guessing anymore. You now have the tools and the rules to look beyond that single word and code with the precision and confidence of an expert.